legislature.
Welcome to TMA's Legislative News Hotline for Friday, February 15th. I'm Brent Annear. Here's what we're covering this week. Emergency Medicaid funding, big news on physician-led teams to provide more care, graduate medical education funding, and preserving women's health care. Up first, this week the House Appropriations Committee unanimously passed House Bill 10. That's the emergency supplemental spending bill allowing the state to fund the last 4 months of the current fiscal year. The measure allots $4.5 billion this year for Medicaid. This budget measure would fill the gap the last legislature created in its attempt to balance the 2011-2012 budget. The bill now goes to the House floor for debate and vote. That should happen next week, and we will keep you posted. There was a big win on the Access to Care front this week. The Senate Health and Human Services Committee voted unanimously to approve Senate Bill 406 by Senator Jane Nelson. The measure clearly redefines the physician-led team to provide care for more patients. Dr. Gary Floyd, former chair of TMA's Council on Legislation, testified on the bill, and then he sat down right here with Steve Levine, and he saluted Senator Nelson for her leadership on the bill.
I'm here today with Dr. Gary Floyd, a pediatrician from Fort Worth and the immediate past chair of TMA's Council on Legislation. We're very excited to talk about some significant movement on one of the most important pieces of TMA's legislative agenda for 2013, and that is Senate Bill 406. Dr. Floyd, tell us a little bit about the bill and why it's so important.
Well, I had the privilege of representing TMA and TPS and TAFP to testify for this bill. It's a bill that has taken months of work and planning and negotiations, and it's an agreed upon bill between physicians, the APNs, and the PAs. It will definitely get rid of some of the old restrictions of the site-based practice, and it leads to, I think, a lot more flexibility, and it puts the responsibility back on the physicians, the PAs, and the nurse practitioners. They're going to have to work together to deliver care.
So an important piece of this is that it reestablishes physicians as the leader of the healthcare team.
This bill defines it's still delegated authority that is that the physician gives to the APN and to the PA. The idea of independent practice is not there. The idea of just a collaborative practice is not there. It clearly supports the idea that medical practice is diagnosis and treatment of disease.
It's up to the physician as the leader of the team to make sure that that quality level is measured and examined on a regular basis.
Yes, this bill clearly places the responsibility in the physician's lap. They can do more than the bill prescribes. They can meet more frequently as they see necessary. The whole idea is that they meet enough with their PA or nurse practitioner that they are delegating authority to get to know how each of them practice and to become an integral piece of the healthcare team.
Senator Jane Nelson, who was the sponsor of the bill that passed out of the Senate committee earlier this week, co-sponsored, of course, by Representative Lois Kolkhorst on the House side, was very excited when she introduced that bill this morning. She was very excited, first of all, that it was an agreed-to bill between physicians, nurse practitioners, and physician assistants, but also because of the amount of work that went into it. How important is it that a bill this complex is agreed to by the parties, and how important is it to TMA's legislative agenda that we've made progress on such a big piece this early in the session?
This is huge. For this to pass out of committee now, right at the start of session, really, it allows us to focus on our attention on many other issues that TMA and physicians in the state have and need to take up and pay attention to.
Thank you, Dr. Floyd. That's Dr. Gary Floyd, a pediatrician from Fort Worth and the proud papa of Senate Bill 406, as it were, which is moving forward an important piece of TMA's 2013 legislative agenda.
Thanks, Steve. Several other TMA physicians testified before legislative committees this week as well. TMA trustee Dr. David Tischer shared TMA's Healthy Vision 2020 recommendations for a healthy Texas and healthy patients with the House Public Health Committee. He also urged state support for graduate medical education funding. He said Texas medical schools are doing their part to produce young physicians, but we need residency slots to keep pace.
What's happened now is our medical schools have stepped up and increased by over 30% their enrollment over the last decade, but we haven't been adding graduate medical education slots. So we know our GME is going to have to take place out of state, and it'll be more difficult for us to retain those as Texas physicians. And with the growing size of our population and the aging of our population, we're going to need a lot more doctors. So we really have to make the infrastructure investments in graduate medical education.
Finally today, Dr. Janet Riolini, chair of the new Texas Women's Healthcare Coalition, testified before a House Appropriations Subcommittee. She asked the committee for more money for family planning in the Texas Department of State Health Services and for the Texas Women's Health Program. These programs serve young working families like the woman who tearfully described how important the services are to her and her husband.
Without the clinic, without any funding, it'd be really hard for people like me in Robstown. And for my husband, we're just trying to make it in life, even if we have to have 2 jobs. And we couldn't afford to have another child. And without this, I don't know where we'd be.
That's our report for this week. Remember, please join your colleagues in Austin for the next TMA First Tuesdays at the Capitol. Next one's on March 5th. For the Texas Medical Association, I'm Brent Annear. Thanks for joining us. See you next week.